Hello, let's discuss composites versus veneers. These photographs are in a book I published back in 2000 on dental diagnosis, just so I would have references for my patients when I was showing them the differences in different restorative methods. And so these initial photographs are in this book. Now these are bonded composites. Bonded composites are effectively when you're restoring chipped incisal edges of anterior teeth, occlusal restoration, smaller restorations. The thing you run into with a composite, or one of the things you run into, is something called coefficient of thermal expansion. That's how much something expands and contracts when exposed to hot and cold. The coefficient of thermal expansion of a bonded composite, it's also called a filled resin, is about 75. The coefficient of thermal expansion of a tooth is about 11. So when you drink something hot and cold, that composite is going like this and the tooth is going like this. So over time, a bonded composite will pull away from the tooth and it will leak and it will stain. The larger the composite, the more the coefficient of thermal expansion differential comes into play. So these smaller composites are good. Larger composites don't hold up. And even smaller composites you don't think of as a long-term restoration. You're probably going to have to replace them over time. So see, in this case, I bonded the chips on the incisal edges of these teeth. One of the things about bonded composite, if you're repairing chips on incisal edges, you can't make the tooth any longer with a composite than the longest part of the existing tooth. Now think about that. I'll say that again. You can't make the teeth any longer than the longest part of the existing tooth. If you do, the person is going to chip that off. The other thing you want to be sure of if you're bonding teeth in a situation like this is that the patient have a night guard, because they did this by grinding their teeth at night. They sharpen your teeth at night, and this is what that looks like. In my practice, most patients have a night guard. You can see how the person has rubbed their teeth together and you get that knife edge on the tooth and then you break that off. So in this case, I bonded that incisal edge that was so thin. Well, if they don't wear a night guard, this is going to occur again, and over time they'll sharpen. The patient will sharpen the outer edge of the upper teeth and the inner edge of the lower teeth, and then they keep breaking these edges off and the teeth get shorter and shorter. That's why we call it comprehensive dentistry. It's not a matter of just fixing the problem. You've got to do something to prevent the problem from occurring again. You can see how this person has worn his teeth down to the gum just from grinding. This person's done the same thing. That's all from nighttime grinding, which is called bruxism. You can look this up on the internet, bruxism. You can't extend the tooth longer than the longest part of the tooth. In other words, that part right there, you can fill in these chips, but you can't make it this long, or you can't make this one this long. If you do, it's affecting the patient's envelope of function, and the composite is not strong enough to stand up to that. Same thing here. See, I've made the composite no longer than the existing part of the tooth. In this case, it would be right there. This case, it would be right here. Now, these are going to look fabulous the day the patient walks out of the office. Fantastic. But as they eat and drink hot and cold, the composite will start pulling away from the tooth and staining. This woman came to my office with bonded composites on her front 6 teeth, and you can see how she's had them for a while. She had tetracycline stain, which is an intrinsic stain that makes the teeth dark. It's from taking antibiotics when the patient was probably 1 or 2 years old while the teeth were forming. And so a dentist had put bonded composite on her front teeth, and they probably looked good when they were first placed, but over time you can see how they've stained. You can see this fluorosis and intrinsic stain on the adjacent teeth. This is what was being covered up, but you can see how these composites have pulled away from the teeth and stained and leaked over time because of that coefficient of thermal expansion effect. So I've now veneered the teeth, and veneers are much stronger. If done correctly, veneers are as strong as natural teeth. Now, I tell all of my patients, even if they don't have restorations on their front teeth, don't bite anything harder than a hamburger with your front teeth, even natural teeth, because the angle is bad on front teeth. See, if you're biting on front teeth, if these are the upper teeth and these are the lower teeth, you're putting, if I'm facing this way, you're putting the piece of food in here, and it's pushing out this way. It's not pushing up that way. Whereas posterior teeth, when you bite on posterior teeth chewing food, you're biting along the long axis of the tooth. I probably have 2 or 3 patients a week in my practice that have chipped their natural anterior teeth, have chipped the incisal edges of their natural teeth. I'll probably have 1 or 2 patients a year that chip a veneer. But you can live a perfectly happy life not biting anything harder than a hamburger with your front teeth. If it's harder than that, if it's hard, crusty pizza, apples, anything that you've got to pull in this direction, that angle is not good. So cut that stuff up and chew it with your back teeth. All right, so veneers are long-lasting, they're strong, they don't stain. We've veneered the upper and lower teeth. They're beautiful. They reflect and refract light like natural teeth, whereas composite absorbs light. So after the composite's been on the tooth for a short period of time, when light hits it, it's absorbed and it's not reflected and refracted like natural teeth. So veneers are like beautiful natural teeth. This is another patient that had bonded composites on her front teeth. She also had tetracycline stain, and you can see how the composites are chipping and staining and how light hits them and it's absorbed. See, she's also got intrinsic stain. Intrinsic means within the tooth, and this was tetracycline. The drug tetracycline was an antibiotic children used to take for ear infections, and it's okay if an adult takes tetracycline because the teeth have completely formed. If children take it that before the teeth have formed, it can make them gray. So she's got these old composites on her front teeth. So I've replaced them with veneers. So you can see how the light looks completely different on a veneer than a composite, and especially a big composite like this. This is called a composite veneer. And it's, if finances are a big problem, then you can put composite on the teeth and make the teeth look better. But if it's large like this, it's not going to hold up for a long time. It's going to stain and chip. Whereas veneers with a night guard could be on the teeth for a long, long time. See, I've bonded the incisal edges that were chipped with bonded composite. We've still got intrinsic stain on the lower teeth, but when the patient smiles, she felt like she really couldn't see those. She's going to come back and veneer the lower anterior teeth at a later date, but this worked well for the initial stage. See, this lady, same thing, has bonded composite on her front teeth, and you can see how it's stained, chipped, and how it absorbs the stain. It becomes darker, and the light isn't reflected and refracted like natural teeth. She also had intrinsic stain. So large composites are especially affected by coefficient of thermal expansion differential. A small one does pretty well if the person doesn't drink a lot of real hot and cold things or drink a lot of coffee or red wine. That's another thing I recommend to people. If you do drink wine, drink white wine, not red wine. Anything that will stain white carpet will stain teeth, and it's especially hard on composite bonded restoration. So if you just as soon have white or something clear, drink the clear. So these are veneers on her teeth. You can see how they look more natural. They don't stain. I think of veneers as long-lasting. I've got a video on how to make veneers as strong as natural teeth, prepared the way that I prepare the teeth and seat the veneers. I use a technique developed by Pascal Monnier and Douglas, which includes the interproximal contacts and the incisal edges. And these veneers are strong. I mean, in my opinion, they're as strong as natural teeth. And I've been using that method for many, many years. This is another woman that had large composites done on her front teeth, and you can see how they've chipped and stained and they absorb stain, and so they become darker just from absorption of the colors that a person is eating and drinking, especially if they drink red wine and coffee. Then these are veneers. See how they don't stain. You may get a little stain on them initially, but it polishes off when the person has their teeth cleaned. That's not the case with bonded composite. It absorbs the stain. This woman had these composite, you call them composite veneers because they cover the whole tooth. But you can see how these are before and after. These are with veneers on the front teeth. And you can see how the stain, and they pull back at the margins. So see, these are composite veneers. It covers the whole facial surface of the tooth, whereas these are lithium disilicate or Emax veneers. You can make veneers out of lithium disilicate, Emax, porcelain, zirconium, different materials, but they're cemented on the teeth. And we've done other restorative work on this woman. Now this is an interesting case. This woman's teeth are beautiful, but she is a grinder. She sharpens her teeth. Even when you're just talking to her, it's just a habit she had. And she wore a night guard, but she did it during the day. And so I'd bonded the incisal edges of the front teeth multiple times. That's her in repose. You can see she had a very closed bite, and she kept sharpening and breaking off the bonded composite on these 4 front teeth just from doing that during the day. And veneers are much stronger than bonded composite. You can actually lengthen a tooth with a veneer. Now you must be sure the patient wears a night guard, because there's something called envelope of function. That's every place the mandible moves when the patient is sliding their teeth around. And if you lengthen a tooth and a patient has worn a tooth away into that envelope with that envelope of function, and now you lengthen it and they don't wear a night guard, over time they can break anything. They could probably break a gold crown on a front tooth. So you must be sure that a part of the treatment, if a patient is receiving veneers, even if they're not. My daughters got a night guard when they were 16, when they'd quit growing. I think that's one of the best things you can do for a patient, is give them a good, solid, centric relation occlusion night guard when they quit growing. For girls, that's usually going to be about 16 or so, and boys, it's going to be low 20s. And if they'll wear that night guard, their teeth will be the same length for the rest of their life, unless they're in an accident or unless they sharpen their teeth during the day, which most people don't grind their teeth like that during the day. This was an unusual case. Most people do that at night. During the day, they just clench. You can see the abfraction on her teeth right here. Some of this has been repaired, and abfraction, as you know, is from teeth clenching. So we've just veneered the upper teeth. We're about to do the lower anterior teeth, and that was because every 3 to 6 months she would break this bonded composite off the front teeth because she just couldn't quit doing that. So after much discussion, we veneered the front teeth. That's the Dental Minute. These techniques work, and they work every time.
Take your practice to the top tier. Subscribe to dentistrymasterclasses.com for an organized library of all the Dental Minute videos, plus many complete comprehensive cases and many very important articles. New cases are added weekly, only $20 per month. Subscribe now.